So this is a soccer player. She was playing soccer. She was going for the ball and got clipped by another player. She felt her knee give out, so she's here today having evaluation of her knee pain. Okay. So first thing you're going to check for is any effusion or swelling that's associated with the knee injury. So I'm just feeling for effusion, no effusion. Next thing I want to check for is any joint line tenderness. So you find the inferior knee or patella and you go along the joint line, which is the space between the femur and the tibia. Any pain? Nope. Okay. And then we're looking for any lateral joint tenderness. Any pain? Nope. Okay. Then we're going to check joint stability. So that's the MCL and the LCL. So let your leg be nice and heavy, heavy, heavy. Heavy, relax it in my hand. Good. So I'm just checking joint stability. Nice and stable there. Stable there. Any pain with that movement? Oh, okay. So next thing I'm going to do is have you lay down flat on the table. And we always check good side or unaffected side first, and then we go back and forth. So first thing is we're going to check the hip mobility. Any pain in your leg when I'm doing this motion? Nope. Next thing I'm going to do is move their kneecap around. Any discomfort with that? Okay. Any discomfort with that? Nope. Okay. So affected side. Any pain with rotating your hips? Nope. Okay. I'm going to check the motion of the kneecap here. Nothing with that. Okay. Another thing that we can check for is patellar tendonitis, which is fairly common in athletes or any athletes that are weight loading commonly. So you want to find the patellar tendon and you push down on that patellar tendon. Any increased pain when I'm moving the knee up? Okay. And then how about when I move back down again? Nope. Okay. And we'll check the affected side. Find your landmark. Any pain with that? Okay. Moving up. Nothing? Down? Okay. The next thing that we're going to check is ACL and PCL stability. So I'm intentionally sitting on your foot here. So we find our joint space and you gently rock to see if there's any laxity in the joint. And hers is rock solid here. And then you always want to let them know when you're assessing the painful side that it might increase the pain while you're assessing them. Sitting on your foot on purpose here. And we're going to check the joint stability here. And she's stable. There's no laxity noted in the ACL or the PCL. One other test you can do is the Lockman's test. So let's see, this way. And so you want to support their leg, and then we're just checking, and this is more for PCL, but you're pushing down to see if there's any laxity posteriorly, and there's not. You'll see a significant gap or a dip here if there's laxity in that joint. And this might be painful, and just relax. And that's stable, so I have no concerns there. The next thing we'll check for is meniscus tearing. So let your leg relax here. And just tell me if you have any pain with this motion, and then you're also assessing for any clicking in the joint, which would signal that she's got a meniscus tear. Pain? Nope. Okay. And this will be quite painful if they do have a meniscus tear. You'll know almost right away. And so you rotate the foot inward, and then you repeat with the foot rotated outward. No pain? The last thing that well, actually there's two more things. One more thing I'm going to check, really, really common in athletes, is tight hamstrings, and it's a really common cause of chronic knee pain. Relax. in athletes and then also middle-aged adults because they're sitting a lot. We should be able to extend all the way. Any pain with that? And you'll notice a lot of tightness back here, and that's a real common cause of knee pain. And she's pretty okay. Getting tight? Yep. So she's lacking a little bit. We should be able to have the leg fully extended. Okay, I'm gonna have you hop up, one last test. And this is checking both meniscus, you can hop off the table, and ACL. It's more of a stability or anything that elicits pain. So you're gonna stand on your affected leg, so your right leg. You're gonna wanna hold on to the table. Let them know it's gonna be painful. I want you to shimmy down and shimmy back up. And good.